We're going to go ahead and get started. So my name is Carrie. I'm a physician assistant student here at the university, and on behalf of the Student Global Health Initiative, we are pleased to welcome you to our hopefully first of several panel discussions highlighting a particular religion or cultural group. Tonight we have an exciting panel that's going to be sharing about their perspective about their faith and their culture and their background. We're going to talk about some great case studies, and I'm really excited to hear from them.
My name is Hassan. I'm one of the medical assistants at the Sugarhouse Clinic, and I did graduate with public health, and I've been working with the Sugarhouse Clinic with the refugees, and I'm glad to be a part of this.
I'm Sarah Ahmad, and I'm a first-year medical student here at PU, and I'll be talking to you guys about Islam and women, so I'm looking forward to talking about that.
My name is Mohamed Musalam. I am a PhD student at the Department of Pharmaceutics here in the College of Pharmacy. I'm originally from Egypt, and I also finished my bachelor from the University of Utah as well. So I will be talking today about the interaction between men and women in Islam.
Alright, so the purpose of our discussion today is how to treat Muslim patients in a culturally competent and respectful manner and ensuring optimal care for them. But before we talk about that, we need to discuss the basic beliefs of a Muslim, which are fundamental to a Muslim's lifestyle. And we need to break some stereotypes before we even get to the subject of talking about patients. And something else we need to discuss is that your Muslim patient will not be black and white, just like any other of your patients. Muslims are a very diverse group. Each have different cultures, different levels of religiosity, and so forth. Today, what we will not be able to do for you guys is give you a list of do's and don'ts about Muslims, because it's obviously you can't group you can't group a bunch of people together and say this is what they all believe. But what we will do is give you the fundamental and the basic beliefs of Islam and give you a little understanding of where Muslims are coming from, just so when you do encounter a Muslim patient, then you have a general idea of how to go about the situation. Lastly, as a provider, it is our responsibility to ensure that we understand our patients. It is not our patient's responsibility to make sure that they speak about who they are and so forth. I mean, it's not their responsibility to keep on defending themselves to us as providers. And so, in order to ensure optimal care, it is our responsibility as a medical provider to make sure that we understand where our patients are coming from and to just listen to them and not make any assumptions and not give in to any prejudice that we may have. And lastly, the point of this discussion is not to point out that Muslims are different and they need to be treated specially. The point of this discussion is to point out that people in general, we as human beings are different, and that every patient that you will see will be unique and will be different. They all needed to be treated in a special and unique manner. So with that being said, let's go ahead and start talking about Islam. So, what is Islam? It is a monotheistic religion started from Prophet Abraham and it ended with Prophet Muhammad. So what does that mean? Well, it means that we believe pretty much the same prophets the Jews and the Christians believe in. And the one different factor maybe from other religions of monotheistic religions that Islam is thought of as a total way of life. Muslims, the followers of Islam, consider themselves, Muslims, the outlook they have in life, the attitude that they have in life, all stems from their religion. And of course, it's different for everyone, but the attitude that they may have concerning a challenge they may have in life comes from their religion. And it is the fastest growing religion in the world, and it is the second largest religion after Christianity. And the book of worship in Islam is called Quran, which is in Arabic. And the thing about the Quran was when Islam was founded, the Quran has stayed the same since. It has been in Arabic and people memorized it from then, and it has stayed in that original format. So again, just to clarify, Islam is the name of the religion and Muslims are the followers. And there are about 1.62 billion Muslims in this world. And that's about 1 out of 4 in the world are Muslims. And 2.5 million Muslims live here in the United States. And this number is not like a concrete number. Some sources say all the way up to 7 million here in America. So, and Islam doesn't necessarily have a language. And the reason I say this is because Muslims come from everywhere, every part of the world. So it is, someone can't assume that a Muslim knows Arabic. It is true that the Quran is in Arabic, the Prophet Muhammad spoke Arabic, but not all Muslims know Arabic. I myself don't know Arabic. I know how to read it, but I don't understand it. These are just some numbers to point out the diversity of the Muslim population around the world. Most of the Muslims actually come from Asia Pacific. The number one, the country that has the most Muslims is Indonesia, accounting for about 12% of the total population. And India and Pakistan follow. The Middle East, unlike most stereotypes out there, account for 19.9%. And the number one population in the Middle East would be Egypt and Iraq and Saudi Arabia. Sub-Saharan Africa is another 15%. The biggest population would be in Nigeria. And then there's Europe and the Americas. Here's a little bit of fun fact fiction. I mean, these are things that I've personally heard. So, yes, it is true that we pray 5 times a day. We have certain times that we need to pray them. And usually before prayer, we have a ritual, like a wash-up that we do, and then we go ahead and pray. And Hassan will talk to you more about prayer later. And yes, it is true that we do not eat any pork or pork products like gelatin and so forth. So that's an important thing to keep in mind with your patients, making sure that medications you prescribe don't have any pig products. And do not consume alcohol. Again, prescribed medications with a little bit of alcohol may be a problem. Fiction. All Muslims speak Arabic. That is not true. Again, as the previous slide showed, it was less than 20% that are from the Middle East. And yeah, Muslims don't come from the Middle East, and a lot of Muslims, I mean, it made this next one, all Muslims have big accents and own a 7-Eleven. Well, it may be true in New York. They may drive taxis over there, but as my later slides will show that a lot of us have some college education. So, and I know that's how movies and shows portray us, but I think it's funny. And all Muslims dress the same. Again, as you can see, we're all dressed differently today. And just wanted to point out that not all the women wear scarves, and not all the women wear the traditional abaya or like robe-like clothing. And I'll have Sarah talk to you about that later. And yeah, that's it for that section. Okay, so according to the Pew Research survey that was done, I believe, in 2007, it showed that American Muslims are generally have a positive view of society, and that they really like living here. There's an overwhelming majority that said that they love being American Muslims, and we don't find any conflict with it. And most likely, you'll be seeing American Muslims in your clinic, so we should give you some information on American Muslims. So the number of population in America is actually, Canada has the most Muslims. Second is the United States, and third is Argentina. And I don't know the exact numbers for Argentina, but that was in third place. About 2/3 of the Muslims today, about 64% are first-generation immigrants, and the rest were born here. That pretty much means that we're staying here, by the way. That pretty much means that in a couple of years, the native-born Americans will increase drastically. And 9 out of 10 converts in Islam are born in the United States, and they are African Americans. And actually, African Americans make 35% of the Muslim population here. They make the biggest group of people. And this is another study showing that Muslim Americans are the most racially diverse in the United States. You have 28% white, 35 African American. I don't see a number for Hispanics, but that's the number that's increasing recently. Asian and other 18%. And you look at the other groups, and they're not as racially diverse, though. And that's something that Islam promotes, is diversity. There really is no culture or any race that it favors. So. This is a slide. The reason I put this slide in is because I wanted to dispel the stereotype that is out there about Muslims, that we're violent and angry people. The point of this slide is not to, like I know it's a comparison with other religions, it's not to break down other religions, but it's simply to break the stereotype that we as Muslims, we condone violence. And the question was asked if it is okay to kill civilians. Is it ever justified? And there's never, sometimes, and depends. And Muslims have the highest rate. Muslims were rated the highest at 89% said never. It's actually 0% for depends. And we also have the lowest in the sometimes category. So. Here's education to prove that we don't work in 7-Eleven. So we're about 40% have a college degree or higher, which is higher than the national average. The U.S. general population is at 29%. So, and the Jews are doing great, the Jewish population. That's a really admirable number at 61%. So I think we probably fall in second in college education. Okay, the reason I put this slide was to break another stereotype that Muslim women don't go to school, and we can't go to school, we're not allowed. Well, 42% of us, more than men, have a college degree or higher. And that's the only category where women is actually higher than men. And again, it's above the national average. So 7 out of 10 Muslim Americans report having a job higher than the national average. And about 3 out of 10 are have a professional job, such as scientists, teachers, engineers, doctors, and so forth. And again, higher than national average. National average is 26%, and Muslims stand at 30% with the Protestants. All right, now it's Hassan's turn. Thank you.
Thanks, Lokman. Now that the Walkman told you guys about the demographic introduction about Islam, let me tell you about how to become Islam and the requirement to be, when they say someone to be Muslim, what are the requirements to be. So to be Muslim, there are 5 pillars. They are the fundamental of Islam, and you have to believe it and you have to do it, all of them. So to start with the first one is declaration of the faith. First you have to believe it and say that there is no God worth to be worshipped except Allah, and Muhammad is the messenger of Allah. Muhammad is the messenger of Allah. And then the bottom one is in Arabic way, and in Arabic is called the Shahada, the declaration. The second pillar of Islam is prayer. Performing 5 daily prayers. As you know, a lot of people say Muslims pray more frequently. And the bottom of the, as you can see, the timing is the 5 times we pray. According to the time schedule as of today, the Fajr prayer is 6:44, followed by the Dhuhr, Asr, Maghrib, and Isha. To perform the Salat, first you have to do the wudu, which is ablution. And as you can see, that picture will show you how to perform wudu. to perform wudu, which is also known as ablution in English, is to clean certain part of your body before performing your prayer. Certain part consists of washing your hands, washing your mouth, washing your nose, washing your face. As you can see, the more it goes to the arms. And we start the right arm first, left arm, left foot, and then right foot and then left foot. Once the wudu has been accomplished, then before the prayer, what happens for the Muslim is adhan, which is calling to the prayer. Like calling to the Muslim to go to the prayer is about the time of the prayer. And as you can see, the person over here that's what happens. One person just goes to the mic and says the prayer, and adhan is just calling to the prayer. After that, then you start to perform your salah. And this is just show you about the different position of the person when they are praying it. You can see it's standing up, bending down with your knees, touching your knees, putting your head down, and then sitting up. These are the common positions. The reason why I want to show you is, when I was going to I'm an undergraduate, I was performing salah in the library, and I had more frequent people come to me and say, "Are you okay? Are you okay? Okay." You don't understand it, but to just show you, these are just how we perform salah. And the other funny things I had was, is this your exercise of the day? A lot of people think like it's exercise, but maybe this is exercise. But we perform 5 days and we get the good deeds. And we can perform the prayer in everywhere as long as it's clean. The clean example is over here. We consider as a clean. The dirty place we consider is the bathroom. So as you can see that over here, the person is praying on the stone. Someone is praying on the street at home. So you can see different people praying in different times at different places. And the reason why is that is you pray. What we believe in Islam is you pray. You perform the prayer whenever and wherever you are. So there's no like place saying like I cannot pray until I get to my home. So there's no excuse like that. So the third one is a charity. Paying annual tax to the poor. In Islam, there is a requirement that every person has to pay 2.5% of their wealth. If you have wealth, then you pay 2.5%. If you're poor, then you can't pay anything. And the reason why we do is to make sure that nobody starves. So the wealth person is always supporting the poor. So everybody has a equal. Every couple times or 2 times food. And the way you can pay is through money as a cash or through as a food. You can also give it directly to the charity to the person, the needy person, or you can ask someone to just be the middle person, and then you give to them, and they just take to the place where the needy people are. The fourth one is fasting during the Ramadan. A lot of people, I'm glad, a lot of people when I say the Ramadan, oh yeah, it's about time to pray, to fast. So I think, as a Muslim population is increasing, the Ramadan is picking up. A lot of people are realizing the Ramadan. Ramadan is the 9th month of the Muslim calendar, and I will explain to you later. But it starts the moon sighting, or the first day of the moon sighting of the 9th month, until the first day or moon sighting of the next month. And during the Ramadan, Muslims abstain food, drinking water, drinking any food, smoking, any medication taken orally or intravenously, and also sexual intercourse during the sun-up to sundown. So at night, the Muslim can eat, at the same time they can perform their regular stuff, their needs. And as you can see, I put in this picture, Muslims tend to practice their religion by reading the Quran, performing extra salat, getting together, eating together. So the Ramadan is a time where the extended family comes together. And the last one is pilgrimage to Hajj. This is every Muslim should perform at least once their lifetime to go to the Hajj. And The Hajj this year is on Sunday, November 6th. As you can, if you guys want to follow, then you can look at it and what's happening in Saudi Arabia. Over 2 million people perform Hajj, standing in one place with different colors, different languages. Then you realize that like Muslims are not only one homogeneous population. And the requirement for this one is you have to be physically able to do it as well as financially able to do it. A lot of people might not do it because they are unable to pay the requirement tickets to get there. So one of the things I would like to talk about is Ramadan. As a healthcare providers, there will be a patient, or you have already dealt with a patient who was fasting during the Ramadan. So it's important to understand what is Ramadan. So the Ramadan is the 9th month of the Islamic calendar, and it's based on the lunar calendar, and the lunar calendar comes 10 to 11 days earlier compared to the year before. And the month of Ramadan goes from 29 to 30 days, so there is no 31 days in Ramadan. I also want to mention, during the fasting, if people fast during the summer, they can fast up to 19 hours, and it's too long for people who have diabetes and other things. So, something to look forward. Ramadan is obligated for all healthy Muslim adults. During the fasting is obligated upon all healthy Muslims during the Ramadan. There is also optional fasting throughout the year. People can fast based on their whatever they want, whenever they want to do it. During the Ramadan, as I said, Muslims abstain food, drinking, smoking, intravenous fluids, oral fluid, and sexual intercourse from sunup to sundown. Muslims, most of the time, will eat twice Muslims will eat 2 meals a day. The first meal is when they break fast, and that's the bigger meal. And then there's a lighter meal when they eat during just an hour before they start fasting, which is half an hour, depends on the sunrise. Even though the Islam require all the healthy Muslim adults to fast, there's exceptional for the people who cannot fast. And some of the exceptions are the people who are sick, individuals who are sick, a traveler for a long distance, a nursing mother, a woman with a menstrual period, and elderly and other chronic issues, which I will talk about. One of the examples will be diabetes. So the health chronic issues will be determined by if it's affected by the health and is becoming dangerous for the health, then they are exemption to not to fast. One research I would like to show you is this. It was done on the Middle East and Asia. There's few research done on Islamic and how to so that it can guide the healthcare providers to what to do when they deal with the Muslim patients with chronic issues like diabetes who insist to fast. So as you can see the numbers, 8.7% was a patient with diabetes, and 91.3% of the patients that was recruited had a type 2 diabetes. What they looked for was lifestyle change, lifestyle, weight, and medication adjustment. And they reported that how often it was hypoglycemic, severe hypoglycemic, and severely hypoglycemic. And this was a report they reported. In hypoglycemic, during the patients they studied, there was an increase of 4.7 in type 1 diabetes, and there was 7.5-fold increase in type 2 diabetes. In hyperglycemic cases, there was 3-fold increase in type 1 diabetes, and there was 5-fold increase of type 2 diabetes. As you can see this, there will be a patient who will have hyper and hypoglycemia, so the doctor can work with them, and so they don't have to, affect their health. The reason why I want to talk about it, emphasizing that the healthcare provider should work with the patient is there are some Muslim patients who are exempted to not to fast, but they will insist to fast. So the health provider need to understand like how to help those patients and make it their fasting, work around the treatment. The reason why Ramadan is more crucial for the diabetes patient to be lower and higher the sugar is because there are a lot of major changes, including meal frequency, daily physical activity, sleep patterns. A lot of patients, a lot of Muslim people will be like praying all night, which is like extra prayer. But they stand an hour and two. But when they have a lot of medical issues, they may not handle it. But the healthcare provider should make them, educate them, do a lot of one-to-one, what they needed, how they need it. So that it's going to be, they can fast at the same time. They can also be, following their treatment plans. So now. The next session will be Muslim woman in Muslim, and then Sarah will talk to you about it.
All right, good evening, everyone. As you know, I'm going to make a transition to talk about a pretty hot topic issue, I would say, because this is something that I get questions about very frequently. And obviously that's the issue of women in Islam and how they're portrayed and what the rules are regarding women in our religion and cultures. And so I'm going to give you some facts and I'll compare and contrast with what you might see in the media and how to sort all that out. And then I'll let you decide from that what your opinion will be. So the first thing I want to start out with, based on the idea that women are viewed as subjugated and oppressed, I wanted to point out some important facts from the religion. And so the first two bullets are showing verses from our holy book, and you can see that when Muslim men and women are addressed in our holy book, both of them are addressed rather than only the man. And so this indicates that there is an equality and responsibility and religious view in our religion. The second bullet, I'll let you guys read. I don't want to be reading from the slide, but a lot of the language might seem very medieval and archaic, but you might be used to that because the Bible is similar. But the main summary of that second verse is that you should not treat women badly. So that's pretty obvious to most of us, and I hate to point out something like that. The reason I do is because Muslims are believed to treat their women badly. And so if they do, it's not because they're following their religion, it's because they're following a cultural practice, and we'll get into that a little bit more. And then the last four are hadith. And do you guys know what hadith are? They're narrations from our Prophet Muhammad, and those are basically his practices and what he said. And so you can see the opinion about women there in those last four bullets. So among my followers are the best of men who are best to their wives, and vice versa for women. Women are the twin halves of men. Paradise lies at the mother's feet. And you've probably figured that one out, right? With your mothers. And also finally, beat not your wife. So beating your wife, abuse is not permissible in Islam. All right, so I chose this topic, female infanticide. I don't know how much history you guys know. If you're like me, I was all into biology, so I don't know much history, but I do know this aspect, and that's female infanticide. So in pre-Islamic Arabia, in that area of Saudi Arabia in the Middle East, the Arabian culture was a pagan culture, so they worshipped idols, and their culture was very, like many cultures starting out, was very chauvinistic and squelched women's rights. And so what used to happen was when a female was born, they would kill the female infant. And obviously this is a very sad occurrence. And so after Islam came to be, there are specific verses in our holy book that address this practice. And so you notice here, this verse is describing when the news is brought to a parent that he or she is having a girl, he's filled with inward grief and he's shameful. Because at that time, if you think about their mindset, men could support the family. Men could do those physical chores that are necessary for survival at a time when there's no electricity and none of those resources that we take for granted today. And so women had, lesser of a value in society than men. And so what we believe as Muslims is that is an evil choice. And this instructed individuals at that time that if they were going to accept Islam, that they would stop this practice. And so this verse I absolutely love because I think it's a poetic expression of how sad this event was. And so when the female infant is buried alive is questioned, for what crime was she killed? It's very sad, and it sounds great when you listen to it in Arabic, so it's hard to appreciate in English. But we do believe that killing an individual is like killing all of mankind, so we don't condone this killing in this context or in any other context. And this is instructing individuals who are Muslim to not bury your daughters alive or scold them. Don't prefer your male children, but and if you don't do all those things, you will be going to heaven, basically. All right, so I want to talk a little bit about our prophet, and his life kind of illustrates a few of the points that I want to talk about. And the first one is that he was fairly progressive for his time. And the first example of that is his marriage to a woman named Khadija. Her nickname is called the mother of Muslims because she was the first individual to accept Islam. And her marriage to the Prophet came by an unconventional route. She proposed to him, as it's believed by many sources, and that she was significantly older than him, and she decided she wanted him as a husband because he was very trustworthy, and she thought he could be an asset to her business as well as a great husband. And another marriage that he had was to Aisha, and she actually narrated a lot of his practices and the teachings of Islam, and actually many of the hadith are written by her because she survived after her husband died, and so this was she was an important figure in continuing his practices after his death. So the title of the slide, you can probably guess what we're going to be talking about. It's Adam and Eve, and so Muslims, I don't know if you knew this already, but we do believe in the similar creation story, Adam and Eve, and something bad happened and now we're all here, right? So that's a basic summary. But Islam is unique because it does not place the blame on Eve for the downfall of man, and it blames both equally. So in the passage that I'll show you in the next slide, you'll see that the language is very explicit. And it does not consider women to be an instrument of the devil, so that's a very unique thing. And whether or not that is practiced is another issue, and I will get to that. All right, so here's the verse. I'm not going to read it, but I've underlined a few of the things. And, Satan whispered to them and revealed their shame, and, now we're here, so summary. All right, so women's rights. I've listed a few of these rights here. So education, property ownership, retaining your own money. Do you guys know when Islam came about? About what year? It was about 1,400 years ago. Okay, so 600. And at that time, do you think that women had a lot of rights anyhow? Or were they just property? They were property. So the fact is that Islam brought rights to women, and you may not know that, but these are facts, and they're backed up by information in our holy book. And so women have the right to earn and retain their own money. They're not obligated to share that with their husband. They have the opportunity to inherit their own property. So in some at some period in the medieval times, I'm not very accurate on the history, but I do believe that women, if they had any property, it would go directly to their husbands, or sons would retain all the property. And so we'd have this property ownership as being another right, free expression of opinions and participation in all religious activities. And women are believed to have the same reward for their deeds in the hereafter. So if you do good, both women and men can go to heaven, and a husband's approval or male approval is not necessary to enter into heaven at all. And also Muslim women tend to retain their own last name. Taking your husband's name is a medieval practice, and so we have very, progressive ideas compared to the norm, I guess. All right, so continuing on these women's rights, I want to mention first, before I go on, about education. You guys might be thinking, well, on the news, all I hear about is women not being able to go to school, and we'll get to that, the specific reasons for that, but I just want to point out that in Islam, women are allowed to have an education and that it's encouraged and it's not at all discouraged. There's no evidence that we can take from any scripture, any belief that women should not have an education. So another right is negotiation of marriage terms. And so you might wonder, aren't all Muslim women forced into an unhappy arranged marriage? I would talk to guys in my undergraduate classes and they just ask me, can you choose who you're going to marry? Well, how does that work out? Aren't you going to be forced? And the answer is no. Arranged marriages, if you guys are aware of some other cultures, in the Indian culture, regardless of if they're Muslim or not, there are Hindus and Sikhs that actually practice this arranged marriage. And so it's not an Islamic practice. And so we believe that you can choose your own spouse and women do have a right to divorce. Another key hot topic issue is restriction of human rights in countries like Iran and Saudi Arabia. It's all over the news, right? We know that women can't drive in Saudi Arabia and that they can't vote. I just want to remind you that in this country, women have just recently, relatively recently, been given the right to vote, and Muslim physicians, actually in a lecture today that I had about mental health and medicine, female physicians are actually at risk for sexual harassment still to this day, and they're still subject to misogyny. And so in this country where we think we're progressive, there are still those gaps. So this still happens, but the key thing is that Saudi Arabia is a monarchy, and a true Muslim country would be a democracy with elected officials. And so their practices are not backed up by Islam at all, and we don't believe that women shouldn't be able to drive or vote or have all the privileges that anyone else should have. So the hijab is something that you guys might all be wondering about. Maybe you already know about it, but that's the Muslim headscarf that many women choose to wear. And what the word that I want you to remember when you think of hijab is modesty, and that could mean modesty in attire, behavior, and any other aspect of your life. And so we place a heavy emphasis on modesty for both men and women, and I think Mohammed will talk a little bit more about that with you guys. But there are a few variances of hijab. Let me just remind you that the full face covering is not mandated by Islam, and when you do the Hajj that Hassan talked about, you're not allowed to cover your face. So the women who do choose to cover their face, like citizens of Saudi Arabia and some other countries who cover their face, they have to remove that face cover. So it's not really it's more of a cultural practice to cover the face, and it's voluntary. It is not something that somebody can make another person do. And the reasons that women wear hijab is basically for dignity, self-respect, and we know that women are sexualized objects from the media, and we know that what gets people to watch things are showing off people's bodies. Everyone loves Kim Kardashian and everyone loves all these other movie stars, and it's no secret why. And so we all know that this exists, and we believe that this is a mechanism to prevent that sexualization and objectification of women. So here's a little comment that I just love, because although I don't agree with this full covering, this is the best one we could find, but it just shows the difference in perspective, where this woman might think, dang, that's a male-dominated chauvinistic culture to be okay with this type of showing of your body, whereas this individual thinks she's totally oppressed. So difference of opinion, just be aware of that. People have different perspectives on these issues. So there's a paradox, and I've alluded to that a little bit throughout my slides, but we see these acts of oppression on the news, and then if you guys have been paying attention to the slides, you'll know that Islam in and of itself is progressive without the influence of culture. And so we know that traditional practices are a mixture of culture and religion, and we know that in any religion, there's always other aspects that influence the practice of a religion. And so those issues that cultures have, like the Arab culture, prior to Islam was very male-dominated, and so those traditional practices have stuck. And so those are what are influencing and poisoning the interpretation of the religion. And also there's a misinterpretation of scripture to defend oppressive ideas and practices, female genital mutilation, driving restrictions. I'll talk about female genital mutilation in another slide. And then there's also socioeconomic considerations. This is complicated, and I don't want to go into it for hours and hours on end. Sociologists could probably talk to you more about this, but for example, in Afghanistan, where it's been subject to continued war and limited resources, you're more likely to have a gender-based division of responsibility and tribal culture than in a country that has relatively more resources, like Saudi Arabia or Iran. And actually, this was in a recent CNN article, I think on the 27th of October, that was published. And women do outnumber men in college in both countries, and the ratio is 2-to-1 in Iran, which is surprising, although they are outnumbered in the workforce. So this example is directly health related, and that is female genital mutilation. There's no other way to address this but to say that it is not endorsed in the Quran or Islamic principles, period. That's it. So only one Muslim country, Egypt, endorses this practice, and it's common in a lot of non-Muslim countries too. So be aware that some of the patients you might see, refugees from the countries that practice this, you may see these issues, and if you know about like the pathologies involved in female genital mutilation, it's important for you to realize that it does exist, but that it's not endorsed by Islam at all. So just in summary, I just want to go over just some few points about providing health care to Muslim women. Shaking hands is an issue that some have, so people may not prefer to shake the hands of somebody of the opposite gender. I personally and some other Muslim women and men don't care, because we realize this is a professional way to greet someone in American society, but it's just based on division of the genders and trying to ensure modesty and etc. And so be aware of that. If someone doesn't want to shake your hand, it's not because they're trying to be rude, it's just a different cultural idea. So, and then body exposure. No one likes to have their body exposed, right? To undergo a physical exam or a procedure. But the important thing about this is that if you're a healthcare provider and you explain the purpose and the steps of the procedure and use chaperones when appropriate, your patient will appreciate that. Another point, I know it's kind of a random fact, but I thought I'd point it out, that birth control is acceptable in Islam, and so a lot of other, more orthodox religions will forbid it. We believe that it is okay. And then remember that there's variation in practice. Every patient is different, and communication is absolutely key. If your patient understands that you're trying to be respectful and do your best to be with them in a respectful manner, they will appreciate that. So I'm going to turn the time over to Mohammed, who's going to be speaking about Muslim men and the treatment of women.
How you guys doing? So like Sarah said, my focus will be how to interact with women, especially if you're a male healthcare provider. There are a few things that we need to understand about how Muslims think and where their thinking is coming from. Can you guys hear me? Good. Okay. So the first thing is people tend to think that men are responsible for women, meaning they make the decisions for them. There were some issues with that where in some cases where the patient needs a surgery, for example, the female patient, and she would not consent unless the husband agrees. So this is something that you might deal with if you're dealing with some Muslim patients. But in reality, this is not an Islamic practice. Because where they're taking this from is from this verse in the Quran, where it says that the men are made responsible for the women, and then it continues, and God has endowed them with certain qualities and made them the bread earners. The word responsible in that particular verse, which is qawamun, does not just mean responsible, it actually means financially responsible. Meaning is the man's job is to provide for the wife. At the same time, if the wife decides to work, she can work. But every penny that she makes, she keeps. She has no financial responsibility in her, for her family. Any money that she makes, she keeps that money. And growing up, I remember my mom, she used to work, but she did not spend a single penny on the house. Not even on herself, because if she wanted to buy anything, it's still my dad's responsibility to buy stuff for her. It's still my dad's responsibility to buy food for the house. It's still my dad's responsibility to pay the rent. So even if she works, she still keeps every single penny that she makes. Saying that, there are men who take it farther and say, no, I'm responsible for every decision, not just financially. So every decision, any decision that you need to make, I'll make it for you. But this has no Islamic foundation whatsoever. But you might see that. You might see a patient who will refuse treatment because the husband is against it, or refuse a surgery because the husband thinks it's not necessary. But you need to realize, one, it's not Islamic. You need to realize where it's coming from, and you need to realize that it has a lot of culture into it as well. Next is touching, shaking hands, especially if you're a physician, would a Muslim woman let you examine her? And this is, it might be problematic for some women, but for the majority it's not. Because all Muslims, scholars, they all said the same thing. When it comes to health, it is okay for a physician, a male physician, to examine a female. However, and this is not just with Muslims, but this is with all women in general, they prefer a female health provider. You'll see a woman comes to the ER and asks, is there a female doctor, or is there a female nurse? They just prefer it. But do not take it because it's a Muslim woman, like, oh, like she's gonna freak out if I touch her, bring the women here. No, she might just prefer it, but then she might be one of those a little bit extreme where she does not want to be touched by a man. And the reason for that also, I quoted a verse here that says, it's just part of the verse, is that divorcing the women before touching them. And this is where the problem comes in. A lot of people use the word touching as literally touching, which means, if I touch the woman, this only has to be in a marriage relationship. But really what the verse is talking about is that, if someone got married, a man and a woman got married, and the marriage was never consumed, then the verse is allowing that, you can go with the divorce without any of the problems that comes with divorce. But this is what the verse was talking about. But some people take it to the extreme, where touching literally means it's a sexual thing. So men and women are not allowed to touch. So you'll see men who would not shake hands. You go and you shake the man's hand, and his hand is in his pocket. He just refuses to shake your hand. But do not take it as he just, he's being rude. It's part of his belief. But again, like Sarah pointed out, that's not everyone's beliefs. I personally shake hands, but you will find people who don't, and do not be upset if someone doesn't. It might be just his belief. The second the point is talking to women, or looking at women. You will find some Muslim men, when talking, especially talking to women, they will be looking at the floor. So he's talking to you, but he's just looking at the floor. You might think he's shy, you might think he is weird or is not respectful, but really he's just not looking at you at all. And you're like, well, what's wrong with him? But, for them, again, they think, because there's a commandment that says, subdue your eyes when you look at women. So you're not, and really what it means is do not stare at them. Do not look at them in a sexual way. But they take it to the extreme where I don't want to look at women at all. I just, if a woman passes by, I just, turn my head. If I'm talking to a woman, even if it's a doctor, I just look on the floor. It happens, and you need to realize, again, there are different beliefs. You'll see Muslims who don't mind looking at the women. You'll see Muslims who do mind. So you need to understand that they're not all the same. The last thing here is the relationships. Men and women relationship. when it comes to dating or boyfriend-girlfriend relationship. It is absolutely prohibited in Islam. The only way that's allowed to date is if it's for potential marriage, and usually the parents agree, okay, you are so-and-so, we know you can go ahead and, meet with our daughter and talk to her, take her out, but this is for potential marriage. It's not allowed to just go out for fun as boyfriends and girlfriends. You could be friends at school, you could be friends at work, but not, the girlfriend-boyfriend relationship that's, everyone knows about. This is absolutely not allowed. It's only allowed when the parents' consent is there, and it's mainly for marriage, which is basically like engagement. You'll also hear about honor killing, and sadly, there are men. Someone killed his wife. If it happens in any different society, it's just looked at as a guy who went nuts and killed his wife. But if a Muslim man does it, then all of a sudden it's called honor killing. But again, this is just a case of, something that went wrong. A guy and a wife got into an argument. The guy killed his wife. All you have to do is put the guy in jail. Do not make the religion as it's the culprit. The religion does not teach us killing your wife because you disagree with her. There's not a single verse in the Quran or in the sayings of the Prophet that says anything about killing any female just because you're in disagreement with her. But sadly, there are people who do it, but there are people who do it in all societies, in all religions. But the sad thing, the media, when a Muslim does it, then it's all of a sudden called honor killing. But this is not true in Islam. Last thing is polygamy. Polygamy is practiced in Muslim world, and they say you can have 1, 2, 3, or 4 wives. But where they take this from is from a verse that really talks about orphans. This is the verse that talks about polygamy. This is the only verse that talks about polygamy in the Quran, where it says if you deem it best for the orphans, then you may marry 1 to 2, 3, or 4. And basically, when this verse was revealed, it was at the time of war, when there was a lot of widows, a lot of orphans, and there's so many women and very few men. So what makes sense at that time is to take care of these women and those children that marry the mother, marry the widows. So that was the reason for this verse. But sadly, you will find Muslims who will practice polygamy outside of helping orphans. They just practice polygamy because they want to have more than one wife, just for the sexual pleasure out of it. But again, if you look at the reason why polygamy was allowed in Islam, was for this reason. But do everyone follow this reason? No. You'll find people who, again, follow their own interpretation of their religion. Last thing that I want to mention, and this is the take-home message, is that there's a lot of mixing of tradition and old beliefs with Islam among Muslims. And I want to share a personal story to bring that home. My grandmother, like I said, I'm from Egypt. My grandmother was raised in this village, and she got married, but a couple of years later, her husband passed away. But then the belief in that particular village in Egypt is that she is not allowed to remarry, except to her husband's brother. This is the only way for her to get remarried, is by marrying the husband's brother. So she ended up marrying the husband who was my grandfather. But knowing this when I was a kid, it did not make sense. Because it has no, again, there's not a single verse in the Quran, it's not practiced by Muslim at all, it's just practiced in this particular village. But they're all Muslims. 100% of the people in that village are Muslims. And they practice this as its religion. And I looked everywhere to see where they got this from, till I came across this verse that says, when brothers live together, and one of them dies and has no son, the wife of the deceased should not be married outside the family to a strange man. Her husband's brother should go on go into her and take her to herself as wife and perform the duty of a husband's brother to her. This is the verse. But not from the Quran. This verse is not in the Quran. This verse is in Deuteronomy chapter 25, verse 5. In the Bible, in the Old Testament. It's not in the Quran. Why? Because Egypt used to be a Christian nation before Islam. And they used to practice the Bible literally. Old and New Testament, literally. And this is one of the practices that they had. But they kept to these practices in Egypt, even after they became Muslims. And till today, this practice is still practiced in some villages in Egypt. And they're still Muslims. So the take-home message is understand that there are a lot of Muslims who mix tradition and old beliefs with Islam. And they practice it as if it is Islam. So do not generalize. Do not generalize all Muslims. Not all Muslims are the same. All four of us here are not the same. We don't look the same. We don't clothe the same. We don't talk the same. We do not practice even Islam the same way. We all have different beliefs. And you, as a healthcare provider, it's just you're going to have to deal with it case by case. We cannot, like what I said at the beginning, we cannot give you a do's and don'ts. You're just going to have to deal with it case by case. So, speaking of cases, we're going to give you some real-life cases that might give you an idea and make you think of how to deal with it. So I might give that to Wagma or Sarah. Thank you.
Okay, so guys, before we do the cases, since we are out of time, we started running a little late, would you guys like to see a few cases and then do some question and answer, or what would you prefer? We want to help you answer your questions. We want this to be useful to you so that you can go out into your practices or wherever you're working and make a difference in that patient's life who may be afraid to see an American doctor or something like that. So how about we look at one case actually? This one is a real case, and do any of you guys just want to chime in each one of us, and should I just go over it? Okay, so this one actually occurred at the Redwood Clinic, and some of you may have heard about it, but I'll let you read it. Basically, the woman needs a hysterectomy. The husband does not want his wife to have a hysterectomy because she will not be able to bear children. And what would you do? She's bleeding and it's in the middle of the night, it's an emergency situation. So what are your comments? What do you guys think? You can just talk out. Say, what do you guys think about this? Even if you say like, let's just do it, who cares, right? Some people have that. I'm one of those people, but what do you guys think? Any comments? Is this a confusing situation? Or? Well, I'll talk about it. What was it?
It's battery.
Battery?
You can't just, they have the right to their own choices, and it's battery if you
Exactly.
to do the hysterectomy on what she doesn't want.
Okay, so...
And also remember the concern that she might want it, but again, it's the husband's consent. It's not her consent.
So is she conscious? She's conscious.
She's still conscious at that time. Yeah. So,
Try and talk to her without the husband in the
Yeah.
room about what she really wants.
yeah, so the conclusion of this was actually negotiated, and the physician actually explained to both of them that this was a necessary procedure and that she would not live. So if you're worried about her not bearing children, she's not going to live anyway. And they eventually were able to do it. But this is a common problem. And again, this is not something, the husband does not make decisions for the wife in Islam. This is not a belief that we have, but it is practiced, and you'll see this in some refugee populations. So this is an important issue. And this was, again, real life Redwood Clinic. So. All right, so the second case, and I think we'll stop with this case and we'll just do question and answer. Is that okay with you guys? So actually, I came up with this case because when I interviewed at a medical school, a physician interviewing me asked me this, but in the context of a Catholic mother and a daughter. So this is, within a lot of religions that have some Orthodox practices, but the girl is suspected of having this syndrome and she needs birth control pills to provide some regulation, and the mother objects, and she's afraid her daughter will become promiscuous if she's allowed to have birth control. This was almost identical to the question I was asked about a Catholic mother and a daughter. And so if you were the physician, how would you explain to the parent and the patient why this medication is recommended? And you don't have to know any of the pathophysiology of the disease, just know that it's needed for the syndrome, but how would you alleviate their fears? Any comments on that?
Can also make it worse for you. So,
in addition to that.
yeah, so some women would refuse to do the pelvic exam even, because especially if they are not married, they're afraid of losing their virginity in the exam. So that might also be problematic. So what would you do? What other alternatives are there for a pelvic exam?
Yes. Jackie.
I'll take a shot at the first one, actually.
Okay.
First question. Well, I think in class, was it a week or two ago, we talked all about sexual history, birth control,
we did.
all sorts of great things. And I think one of the things Dr. Tippett mentioned is like, hey, lots of people take birth control not for birth control. So maybe kind of hitting on those points. And then if you were a really well-informed physician, perhaps you have some resources to be able to say, well, it actually doesn't affect whether teenagers have sex or not, whether they're taking birth control. You know what kind of things have been done.
Yeah.
Some people take birth control, not
Exactly. So the multiple use of the medication, it's used to treat acne. In case you guys don't know, it's used for many purposes other than birth control. So I think, and I put this in one of my slides, communication is key. If you're having a problem with your patient, if you can get to their level and show them respect and communicate everything clearly, you'll have great outcomes. I'm positive, because it's all about, I mean, you have that time with your patient. If you make use of it, things will go generally in the right direction. So let's conclude with questions.
Actually, had a question along what you said. Would a Muslim woman still feel like she would lose her virginity if she had a pelvic exam performed by a female provider? How does?
Yeah, so it's all about the hymen, right? If that's broken, then she lost her virginity, and that would be a concern for her.
Okay.
And you'd be surprised. It's like a big deal for a lot of Muslim women, and especially for the parents. She might not have a problem with that. She's in pain and she would rather do the pelvic exam if it's going to be a treatment for it. But her parents will be against it.
I'll give you a real life example. I had a friend who came to me and she was telling me about symptoms that she was having that I know a little bit about that do indicate PCOS or endometriosis. And she was having severe pain, very heavy bleeding, among other things. And, you know, I was telling her, you need to go into the doctor and get examined. She was telling me she's afraid to go because they're going to do a pelvic exam that's going to break the hymen. And I was saying, well, you know, if you talk to the doctor, maybe, because the diagnostic criteria for PCOS and endometriosis does require that it be, for a definitive diagnosis, for it to be diagnosed through surgery. It has to be observed because there's no way to see it, you know, outside of the body. Even ultrasound doesn't give you anything definitive. So I said maybe, you know, they can work with you. And they really did prefer having surgery than a pelvic exam because at least the hymen would remain intact. Because it plays a part in marriage too. If later on she gets married and her hymen's not intact and the person that she married finds out when they consummate the marriage, he has grounds to divorce her.
Although technically he shouldn't, because there's no way to know if a male has been promiscuous or whatnot. Or I mean, that's a personal thing, so it's unfairly biased toward the woman just because of anatomy. So in Islam, we don't believe in you know, in discriminating against women in that way. It's just that's how it is, and so it causes a lot of problems.
But again, it's a very cultural thing. Very cultural. Like again, speaking of villages in Egypt, some of the culture is on the day of marriage. On the next day, they go to the husband and wife's house to look at the sheets that they stepped on, and we expect to see blood. So this is like a very cultural thing. So,
Another question?
question.
What is like the opinion or whatever about female providers for male?
So I guess for men, they don't have that much of a problem, right? But you'll also see that men will be like, you know, I'm more comfortable taking off my clothes in front of a male, for example. I don't want to take off my clothes in front of a female provider. You might see that as well. But it's not as problematic as with women. You know, a lot of men do not have the problem. Do not mind men or women healthcare provider. But I'm sure Sarah can add to that.
Yeah, so we've been doing physical exams, and I will just tell you that when males and females try to do physical exams on each other for practice, it's awkward anyway. And so typically, for healthcare purposes, men and women should not mind if the opposite gender examines them, but there will be a preference. And again, it just, if you communicate with your patient, if the patient is really uncomfortable, and you don't want that to inhibit the exam at all. The muscles tensing up and other aspects will really interfere with the exam if you know how to do physical exams. So you don't want that to be an issue. So I think communication is just preference for what the patient wants.
And then on the other hand, I'll give you a little personal experience that I had. Some physicians who I went to go see a male physician, it was an emergency appointment. I could not go see my own physician, and so I went in for earache, sore throat, and all that typical stuff. He didn't even get near me because he was so afraid of my reaction. Didn't even look into my ears, just wrote a prescription for antibiotics. I found out later that it was allergies, and I did not even need antibiotics. And all he could have done was ask me, is it okay for me to, pet and touch you, or not even say the word touch, but is it okay for me to examine you? And of course I was okay with it. That's why I had scheduled it with him. And again, it all comes to personal choice. Most of the time, women are aware who their providers will be, unless it's an emergency room situation. And I have been in the emergency room where I was literally rushed to the hospital. I was pretty much unconscious, and at that point, people don't care. And even afterwards, I'm like, oh, everyone just do whatever you need to keep me alive at that point. So. Another thing that I wanted to say was that, on the other hand, even with women, I've noticed that women are sometimes uncomfortable touching a female Muslim patient. I've experienced that too, so it's both. And I think it just comes from uncertainty of our reactions. And you just have to be open. It is not offensive to say, is it okay to do this, or I will be doing this, are you okay with it? That is totally fine, and we'll let you know. If we're not okay with it, we'll tell you. And so that's all I wanted to say.
I just want to add one more thing. I mean, as we already mentioned, Muslims come from a variety of backgrounds, and sometimes some of the male never had interactions with the females a lot of times. So when they come to this country where males and females are sitting in class, they may still feel uncomfortable, let alone, female doing the physical exam on them. So, as we said, at the end of the day, what will save you is ask the question, is it comfortable? Are you comfortable? So every time when the Muslim patient comes there and I'm drawing blood, I always ask them, do you feel comfortable me doing your blood work? And a lot of times they're fine, but there are certain cases where they will say, I prefer female. And that's reasonable, because there are a lot of times they never had a male and female interactions, in their home country. Some of them went to school, only male schools, and then female schools. So I think just asking makes a difference, because in America, when, male and female sits there, we don't see big deal, but in some home country, Muslim country, that's not acceptable. And so, and then for them to come here and then see all the sex coming closer to them is really uncomfortable. Forget about the, physical exams. So I think I just want to point out that.
Okay, so I think we'll just wrap up and thank you guys for your questions and support. And we hope you guys took a lot from this. And if you have further questions, you can feel free to ask us afterward. But thank you and have a good night.